Hello, everybody. My name is Nigel, Member Relations here at the Chamber, and we are very excited today to welcome in the team from PCNM. So welcome to our September Boss event, sponsored by Lynn Woodcroft of Royal Frank LePage Realty and Bell. Always appreciative of our sponsorship for these events and all of our other events. If you're interested in any sponsorship, just let us know. But yeah, that's very thankful to Lynn Woodcroft and Bell. This month, we are featuring two amazing people in Lynn and Dr. Brenda Tapp. They will be discussing how clinics and healthcare must adapt to meet changing needs of patients. They will offer ideas that blend creativity, best practices, and research. So now, before I share any more, why not just hand it over to them, to the team at Peterborough Center of Naturopathic Medicine. So Lynn and Brenda, why don't you take it away for us?
That's funny. Thank you for the introduction, Nigel. We're so excited to be here. Before we introduce ourselves, I wanted to just do or give you a little personal story of mine just to kind of set the stage for our talk today. And I want to apologize with the kids going back to school. The germs are already being spread around. So I have come down with some sort of cold. So if my voice cracks or I lose my voice, I do apologize. But anyways, let me jump into this personal story that I want to share with you guys. My husband, Mike, had a surgery during the pandemic, and I've gotten his consent to share this story. Typically, prior to a surgery, you'd have a pre-op appointment with a nurse who would do your vitals, send you for blood work, make sure your liver and kidneys are functioning well, make sure that you're a safe candidate for surgery. But Mike's pre-op appointment was over the phone. There was no physical exam done, no blood work ordered, and his surgical team didn't even see him until the day of his surgery. So they had no idea what he even looked at. So Mike had his surgery, and when he came out of his surgery, I had to pick him up at the hospital. And you know, he was handed this baggie of gauze and tape, and I asked him what sort of pre or post-op care he was supposed to do. When were we supposed to change his gauze, his bandages? How was this working? And he said no one told him a thing. He was just handed this baggie and sent on his way. The only thing that he was told was that someone would call him in a few days to check in, to make sure that his surgery went well. And if no one called him, he was to call them. So of course, no one called him. And when he tried to call the hospital at this special number that he was given for the surgical unit, no one answered, and it went straight to voicemail, but the voicemail was always full. So he got zero post-op care. No one checked in on him, and thankfully his surgery went well and there were no complications, but this isn't the case for everyone. I think we all have similar stories, or we've heard of things like this that have happened throughout the pandemic, but this is a prime example of how our medical system is overworked and unfortunately broken. When Lynn and I decided to do this boss talk, business owners sharing solutions, we bounced a lot of ideas off of each other. Neither of us have attended a boss talk before, so we weren't quite sure what to expect or what to discuss. But the solution that we're going to propose to you today is one to support our local healthcare system. By the end of this discussion, our goal is that we will have inspired you to try or to open your eyes to this one possible solution, but also maybe inspired you to try this for yourself, for your own personal healthcare too. So it's kind of a twofold solution, one for our community and one for you personally as a business owner or as an entrepreneur. We have to be at the top of our game. We cannot let poor health hold us back. Poor health means less income, time taken off work, less innovation, less growth, and a smaller impact. So health is a top priority for us as business owners. But before we get to introducing ourselves, I just want to define what health means for the purpose of this boss talk, because it means different things to different people. So our current model of healthcare is a very extreme model of healthcare that tends to view the body as a machine that needs to be fixed when it's broken. This type of healthcare really emphasizes the treatment of disease, but only when there is a disease, which naturally leads to negative measurements of health, like rates of disease or even death rates, as we've seen through the pandemic. But it also tends to de-emphasize disease prevention. My preferred definition of health is one that's defined a little bit more positively by the World Health Organization. And this is a model which views health as more of a dynamic scale. So not so black and white, but a scale of health, and almost as a state of resiliency. So this model emphasizes social, environmental, mental and emotional, and physical health as resources that we can rely on throughout our everyday life. This is also known as the biopsychosocial model of healthcare. So as business owners, I believe this is a better model of health that keeps us in a better state of health so that we can have a greater impact and we can come to the table with our businesses in a better state of mind. So I like this wellness model of healthcare. All right, so just a short little introduction about myself, and then Lynn can introduce herself as well. Why are you here listening to me talk about healthcare? Well, that's because I'm a clinician. I've experienced the healthcare system day in and day out for the last 10 years because I've worked in it. I have a private practice as a naturopathic doctor. So my practice is typically filled with patients who have gone through the medical system and have been told, you know, I don't know what's wrong with you, everything looks fine, but they still don't feel fine. So my job as a naturopathic doctor is to bring people from the line of fine to feeling awesome. Now, I also run my own clinic. So I'm at the clinic in East City right now, and there's 9 clinicians here at the clinic and 4 administrative staff. I hear my patients tell me every day about their experience with the medical system, physicians and specialists. So not only is the pandemic showing us that the system is broken, but there's also a huge demand for a shift in our healthcare. This extreme medical model is not what people are looking for anymore. I find in my practice, which is maybe a little bit biased, that people are looking for more nutritional support. They want evidence-based supplements to include in their healthcare. They want counseling. They want wellness. On one hand, I'm really grateful that I'm outside of the scope of OHIP because I get to spend 30 to 60 minutes with my patients. It sounds like a really long time, but as the time honestly flies by because we're talking about so many different things. We're talking about educational information, how to help develop strategies to implement diet and lifestyle changes. I get to clarify what test results mean. I get to perform really thorough physical exams, and I get to help people navigate the OHIP system. But on the flip side of things, because I'm outside of OHIP, it means that my care is not as accessible as I would like it to be. So I'd love for everyone to have a naturopathic doctor, but we're often only seen by those who have benefits or by those who have a disposable income, unfortunately. So part of that comes into what we're chatting about today. Lynn, I'll let you introduce yourself.
Hi, so I'm Lynne Galliaza, and I am the counselor here at the clinic. And I've been here for just over a year, and I've been working in the field of social work for over 20 years. And certainly I earned my degree from both McMaster and Dalhousie. And my background has both been within hospitals, but as well community, mental health, and as well within home care and the area of palliative care and grief. And I would say that I've got 3 really areas and distinct areas of passion, and it's wellness, as Dr. Tapp was speaking about, the grief and palliative care piece, and ADHD and learning disabilities. And I want to share a personal story. And I think what's really important is that as I've been able to work with more people and listen and really start to understand, my personal experience is really not different than what a lot of my clients are experiencing as well. My passion for working with people with ADHD and learning disabilities really grew out of my own personal experience. I have a neurodiverse family, and so there are multiple members of my family that do have ADHD and learning disabilities. And it was when my kids were young, my husband and I just, we identified some concerns, and this is a while ago, and really our options at that point were we could join the wait list to have a psychoeducational assessment through the school board, and even at that time it was more than a year, or we could pursue an assessment privately. And we're really fortunate, and we were able to pursue that assessment privately. And what that meant was within 1 year, we were able to have the assessments and then have an IEP and accommodations in place for the next grade. And that today there are some differences, that's the wait for reassessments, and certainly we have experienced that, the wait for follow-ups, for medication reviews, all that, it's getting longer, and we can wait for months and months. Now, we've been super fortunate, so I don't want to suggest we haven't. We've worked with really knowledgeable, kind, credible professionals, and I learned a lot, and I find what they taught me was the language. And so I was able to learn the terms that I needed to use in certain systems and processes that we had to put in place. Where the gap for me is in the knowledge and the understanding. So what does, executive functioning skills and time blindness and things like working memory, like what does that actually mean for people day in and day out? And how is it different for people, even if we share the same diagnosis? And I had to teach myself that. And I feel that in some ways I fell into that learning quite naturally because of my background. So I'm accustomed to researching, reading, listening, taking courses, asking questions, preparing for appointments. I have advocacy skills that I've been able to develop. And so that, and even with those skills, it was sometimes discouraging, and really it felt huge. And so, like Dr. Tapp was talking about, it's that when we focus on wellness, it's getting back to and also including, information and providing people with the information that they need about themselves, so that they can then spread this across their lives. And I know that here we really want to be part of the solution.
Yeah, thank you, Lynn. Okay, so let's go on to the next slide, if that's okay. So when a universal healthcare system is not able to provide the basic healthcare needs to those who pay into it, we have to start working together to fix it. And the key here is the word together. This isn't just a problem for physicians and nurses. There are so many other regulated clinicians like myself and other healthcare providers like Lynn, and we've got nutritionists on the call here, who are ready and waiting to help to develop this wellness for people. The entire problem of our healthcare system is not going to be resolved by our government spending more money on healthcare. Our government budgets for bigger hospitals and more beds, but why aren't we trying to prevent people from needing these beds in the first place? The government also budgets for the hiring of more doctors, nurses, PSWs, and also for the increasing of their wages, but there's a shortage of these people now, even with increased wages. So where are these people now? We also need to train these people when we find them. So that's going to take a couple of years. And pumping out new grads faster really isn't the answer, because a new grad is nowhere near as proficient as someone who's been in the healthcare system for 5 to 10 years or more. We need to give these new grads time to develop their skill set. And here's the other question. Are we just expecting ourselves to be more sick as we get older? Is this like we're just expecting that we're all going to be a lot more sick than we are now, and this is why we need more beds? That doesn't sound appealing to me. I don't just want to wait for that to happen. So what we're going to propose to you today, and I swear we're getting there, I promise, is it's not a new way of doing medicine. It's already here. We just need to bring more awareness to it. So we're going to bring more awareness to it today. The solution that we're proposing means we can get more out of our current budget without spending more money. It means we can get more from our current level of staffing without increasing levels of burnout. So we're not putting more on people's plates. And it's already here. So we're not waiting years for new grads to come from school. So I want to start out by explaining different types of healthcare, because what we're going to talk about today is one form of healthcare. So right now, our healthcare is typically what's referred to as one-on-one care. So where a clinician or your physician meets with one patient at a time and then moves on to another one and then moves on to another one, but it's always just one person at a time. And this is how everyone is trained. There's no, like, even I'm trained this way to have one-on-one care. So there's definitely pros to this kind of medicine, but there are lots of cons. And unfortunately, these cons are really rearing their head with this pandemic. So some of these cons to one-on-one healthcare is that it tends to result in shorter durations of appointments, so that, physicians can bill OHIP enough to bring in enough money to actually keep their family healthcare team open. So it results in shorter appointment times. It burns out the healthcare provider. Imagine having 10 to 15 to 20 different 10-minute meetings with people in a day. It's exhausting. It's really heavy work. And I can tell you that from personal experience. It's emotionally draining, and it impacts the clinician's mental health, which means it also impacts their relationships. A burnt out healthcare provider doesn't deliver the best care. They aren't in the headspace that allows them to think critically. Mistakes get made more often. Medications aren't explained fully. Test results aren't explained fully. It just is a recipe for disaster. And the third con is that it's also the most expensive type of healthcare. We have so many specialists now that by the time you've seen 1, 2, 3, 4 different specialists before you actually get your treatment, we've billed OHIP 1, 2, 3, 4 times. So it's a very expensive type of healthcare. And if you think of it from those people who choose to include, or those patients who choose to include allied healthcare providers like myself or Lynn, these people are paying out of pocket for our care to build wellness in their life. So it's an expensive type of healthcare. But then we've got more less expensive types of healthcare. So we've got like our public health. So these are the posters that are put up in your physician's office. We've got what else do we have? We've got social media. We've got the internet. We've got Dr. Google, which isn't always the best kind of healthcare. I sometimes refer to this as DIY healthcare. So it's a less expensive form of healthcare. Social media is a free form, though it may not always be the best. But then we also have group healthcare, and this is what we want to bring more awareness to today is group healthcare. I'm not saying we get rid of one-on-one care, we definitely need it, but group healthcare is a way that we can really ease the burden on a lot of our one-on-one clinicians. So on a very broad level, group healthcare is where one clinician meets with multiple patients for an hour or two, typically on a regular basis. So, once a week, every other week, once a month, but it tends to be a very regular basis. So on the left side of my screen, I've got your typical one-on-one care, and on the right side of my screen, I just made a little diagram of what group healthcare can look like. Think of it, it's like going to a workout class at your gym versus hiring a personal trainer, right? The workout class is a little bit more accessible financially for people. You get the camaraderie, you get the support from the other people who are attending the workout class versus hiring your trainer at a gym. It's more expensive. It's not as accessible for a lot of people, and you don't get that group support where, you know, you've exchanged numbers and you check in on each other if you don't show up at a class. So that's what group healthcare is, and it's already here. You know, when you go to see your physician, you often get a prescription for a pharmaceutical, or you loosely get recommended, you know, eat more produce, eat a little bit healthier, eat less takeout, go work out. But you're sent home and you're literally plopped back into the same environment that made you sick to begin with. So we all know how to eat healthier. We all know we need to. We all know we need to be more physically active, but why does no one do it? No one does it. Well, a lot of us don't do it. And a big part of that is because when you go home to your friends and your family, to your circle, no one else is making the same changes that you are. So you're one person in your little group and no one else is making changes. And so those changes feel restrictive. Eating healthy feels restrictive when the rest of your family is eating takeout 3 nights a week. You know, those changes feel restrictive when going for a run is what you know you should do, but your family is sitting on the couch watching Netflix. So instead of feeling like these changes are bringing wellness to your life, you feel alone in these changes. So with group healthcare, you are literally paired with many people who have the same health goals as you. And what we find, Lynn will get into the research shortly, but what we find is that group healthcare is way more successful long-term in transforming people's health. And this is what we're trying to get at with wellness, than one-on-one care. Mm-hmm. And group healthcare is already here in Peterborough. These are just a couple of examples. Our family health teams offer mindfulness programs, and so many of us have no idea that it's there, but you can already go to your family physician and ask to be referred to these mindful programs that are covered by OHIP. There's no cost associated with them. And these mindfulness programs will help with things like stress and sleep and cardiovascular health. And, you know, if we can help with those things, we literally approach our day in a better mindset. Telka and Smith, which is a local psychology practice, they also have mindfulness programs too, group health programs. Dr. Wendy Thomas is a family physician here in town, and she offers a group health program. I don't know if she's still doing it right now, but she did at least offer a group health program on metabolic health and diabetes. So she would get all of her diabetic patients together and see them on a regular basis, teaching them about how to eat healthy. And then we also have a group health program for women called the Wild Collective. So Lynn's going to talk to you about that briefly shortly. Weight Watchers is another prime example of group healthcare, even though it's not led by a clinician. And Weight Watchers is so successful for so many people. And the other example I have too is the Gina Levy program. I know it's not a local Peterborough program, but I'm sure half of Peterborough has tried this program. Gina Levy is helping her female, I think it's females, eat healthier and be more physically active. And there's, you know, daily check-ins, and there's camaraderie between the participants. So this is what group healthcare is. So group healthcare, like I've mentioned, improves patient outcomes substantially. When we have more wellness, we become less reliant on our healthcare system, which is what we, you know, will help the problem. There are 12,000 people in Peterborough who don't have a physician, and there's I believe his name is Kevin. He's been hired by the city to try to find and hire more physicians for the city of Peterborough, said that we need 10 new family physicians to meet our need. If we just hire one family physician and they start offering nothing but group healthcare, we will be able to get those 12,000 people more health faster if we have this group healthcare model. So it's beneficial for patients. It's also beneficial for the healthcare provider. You get to celebrate better wins for your patients. This is why we got into healthcare, because we want to see people get healthier. And so we get to celebrate better wins for our patients because they're actually transforming their health. And two, it's less burnout for the clinician. So if the clinician is less burnt out, the care they give their patients is just better overall. And then it helps our community. So the third benefit is it helps our community. Group healthcare is not as costly as one-on-one healthcare. So we're billing OHIP less. When wellness of members of a community improves, so does the resiliency of that community. When wellness improves, our relationships with friends and family improve, business start to improve. This is like a win-win-win-win-win solution here. So we just need to bring more awareness to it. So Lynn's going to talk about some of the science, some of the studies that have been done on group healthcare to give you even more motivation about how awesome this is.
So I've got 3 articles that I want to touch on, and I want to say, in no way is this an exhaustive search. There is a lot of information out there, and anybody who is curious, you'd have no problem doing a deeper dive and finding some more information. Now, the first article I want to highlight, it was published in March 17th, 2021, and it is about the benefits of a psychoeducational happiness course on university students' mental well-being, both before and during a COVID-19 lockdown. And part of what led to this is that young people entering higher education across the world are facing a mental health crisis. It notes in the last decade, students in the UK have reported a 5-fold increase in mental health problems, that in the US colleges are not reporting anything different. In a 2017 survey, they found that among current US college students, over 50% reported feeling hopeless, 30% felt too depressed to function, 60% were experiencing overwhelming anxiety, and over 10% were seriously considering suicide. The World Health Organization reported that 35% of first-year students from 19 colleges across 8 countries screened positive on self-report measures for at least one common DSM anxiety, mood, or substance disorder. And that this journal, the researchers were drawn to the possibility of improving student mental health by offering courses in the psychology of well-being and in a form of psychoeducation. And I want to tie this back to the Wild Collective as our psychoeducational group, because their findings suggested that the psychoeducational courses, they raised levels of mental well-being in a relatively cost-effective way for large groups, delivered both face-to-face and possibly online, which, as we know, we've had to shift often in the recent years. And that another area they noted was that it is like these courses could be normalized across disciplines. It could, and then they would be able to study it and follow in more diverse populations and just to see it across a broader population. The second journal article I want to highlight was published May 18th in 2020, and it's who benefits most from resilience building groups for at-risk older people. And again, it focused on a program, it's called My Generation, and it's offered in the UK. And its aim is to build resilience through greater access to social networks, well-being activities, and psychoeducational supports. And it consisted of 8 weekly 2-hour group sessions. And it was a combination of psychoeducation and well-being activity. And that they noted that it improved well-being, self-efficacy, social connections, and aspects of loneliness in at-risk older people. And so the last one I want to highlight is my favorite. I do love this study, and a lot of people know of it, so I may not be telling you anything new. The Harvard study of adult development, and there's a great TED Talk by Robert Waldinger, and it's called "What Makes a Good Life and Lessons from the Longest Study on Happiness." It has been viewed more than 23 million times, and what this study has shown is that close relationships, more than money or fame, are what keep people happy throughout their lives. Those ties protect people from long life's disconnects. They help to delay mental and physical decline and are better predictors of long and happy lives than social class, IQ, and genetics. And this was true amongst the participants, which was Harvard men and inner city participants. And we know that's important because there are different risk factors in both of those groups of people. And the fact that they had similar and the outcomes mirrored each other says a lot. And also one thing that does grab me is that it was focused exclusively on men, and that the wives and the women in their life wasn't included until recently. So they also noted that loneliness kills. It's as powerful as smoking and alcoholism. And Waldinger said that aging is a continuous process. You can see how people can start to differ in their health trajectory in their 30s, so that by taking good care of yourself early in life, you can set yourself on a better course for aging. And the best advice I can give, he says, is take care of your body as though you were going to need it for 100 years, because you might. So I love this study. It is worth listening to him in his TED Talk. It's worth going and taking a look at it. So this links to our Wild Collective, because the Wild Collective, it's about bringing women together. It's about building connections. It's a safe and supportive environment. It's a place where information is shared. We get to question it. We can explore it. It's experiential. It adds in skills. We're going to practice skills. Its focus is on the wellness and acknowledging how powerful knowledge is in our wellness, as well as those skill building and that sense of self-efficacy, which is really important to us at our cores. Now, the topics that we're going to cover, they are my menstrual cycle, menopause and perimenopause, my detoxification, my digestion, my thyroid, my vision and mindset, my stress, my breast and vagina, my brain and mental health, my blood sugar regulation, and my divine feminine. Now, next week, I'm a co-facilitator. Thrilled, I'm excited. I'm going to be co-facilitating with Rebecca Caravan here. She has taught the Wild Collective a few times. We are offering a free webinar for more information for anybody who's curious. That's happening next week on September 27th at 7 o'clock, and you can register for that. And we're going to give you a little taste of information, just to give you a hint, and where our focus is going to be on menopause and perimenopause. And then we are officially launching the next round of the Wild Collective in October, and it's going to be on October the 18th, and it's something that you can sign up and register for.
Amazing. So yeah, as you can see, we're pretty passionate about building wellness in our community. We both agree how important it is for overall health and long-term health. And we truly believe that group healthcare is a big part of that. Sure, it's just a group of people getting together to learn, but on the other hand, it's a radical transformation of patients' health or people's health. And really, if enough people do it, it's a transformation of our healthcare system too. So we hope that we've brought awareness to how powerful group health can be, and maybe even inspired you to try out a group health program too. In prep for this talk, I also watched some TED Talks as well. And there was one that kind of rounded itself out with something that I really liked. So I'm going to share it here. I can't remember the TED Talk. I should have remembered the TED Talk to be able to reference it here. But anyways, in the private sector, when you can squeeze that kind of additional value out of a fixed cost, it's called a billion-dollar company. But in my world, it's called reduced diabetes, reduced IBS, better mental health. So I thought that was a very cool way of wrapping up how powerful group healthcare is. So thank you for everyone for listening today. If anyone has any questions, we're happy to answer them. But if not, we hope you have an amazing rest of your day.
Thank you so much, Brenda and Lynn. Yes, like they mentioned here, if you have any questions, feel free to just unmute and ask. To get that started, I do have a quick question. When you're talking about group healthcare, is this something that you're suggesting for all situations, or is this more like when it's possible, this would be a great way to be more efficient, to add accountability and to build community?
Yeah, I think right now, the group healthcare that we have available to us is primarily mental health, but I think most of us have, if not all of us, have experienced some level of stress, anxiety, insomnia, feeling overwhelmed, and learning those tools from a group health program would really impact other areas of our health as well. I think we need more group health programs on cardiovascular disease and diabetes and metabolic syndrome and maybe even cancer. Yeah, so we definitely need different types of group health care, but from a preventative standpoint, I think the mental health ones are a really great place for most of us to start.
Yeah, absolutely.
Mm-hmm.
All right, if anyone does have any questions, feel free to unmute yourself and share.
I saw something come up in chat, and is it okay that it says to everybody, so I'd like to just read it. Is that okay?
Absolutely.
Okay. So Lindsay wanted to make a comment, and she says that group healthcare might seem intimidating for some, but seeing that you are not alone in your situation can be very powerful. And I think that's so well said and agreed 100%. And I've certainly witnessed that. There is a lot with shared experiences. And when we are left alone with our questions and our worries, it can be very isolating. And it is, there really is something about having a safe space where you can come together and feel comfortable and share. And I do have to say, you know, we often have to realize this and learn it many times in our lives. But if we've got a question or concern, chances are there's somebody else that's having a similar experience or can relate to what we're saying. And so that it's a way of putting things out there and learning that it's bigger than the individual. Those connections are huge.
On the other side of that too, sometimes one-on-one healthcare can feel intimidating. I know from my practice, I've had some new patients come in and say, you know, I've been nervous to come in and see you. I've been worried about what you're going to say to me. So sometimes group healthcare lets you get the information, but not be responsible for saying anything. You can just listen to the information until you feel comfortable sharing that sort of information, if that makes sense.
It does. Mm-hmm.
Any other questions?
I'd just like to say thanks to you both for a great presentation. I think at the heart of group healthcare, from my perspective, what I'm taking away from this and based on my own experiences is education and empowerment. Because the more that we come to know and understand about ourselves, the more empowered we are then to take health into our own hands and to really promote our own wellness and to set that example for others. So thanks very much. It was great today.
Yeah, thank you.
Thank you.
I had one other question here come in through a different chat, regarding top 3 burnout tips for managing burnout. Is that something that you could address as well?
Sure, yeah. What are yours, Lynn?
I say. So with me, and I don't know if this will quite get at, it's noticing. I think it's really important that we build an awareness, increase self-awareness, and noticing what our clues are, get in tune with our body so that we notice those signs. And then as we are noticing and our self-awareness increases, then we can start to try to understand them and investigate them. And then we can begin to learn how to take care of ourselves and to nurture. And so that, I realize, is a very individual focus and might be somebody's individual process. And then of course it can get much bigger than that, because if burnout is related, and it often we're a variety of different systems and touch points. So it also typically extends out to the stressors in our lives and to those other pressures. And so how each individual takes a look at those pieces and then chooses to approach them, there can be just a unique way of leaning into that type of work.
Amazing. Yeah, I'd say my 3, if I can give 3 tips for burnout as well, is prioritize sleep. Always, 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 always. Never give up your 8 hours of sleep for anything. How you take on the day depends on how you slept at night. So I know sleep is something we tend to brush off and say, I'll catch up on it on the weekend, but we should never cut back on our sleep ever. So that's a really big one. Good sleep means good hormones, means less stress, means better focus during the day, more productivity during the day. So prioritizing sleep is a big one. I always tell people to never have coffee on an empty stomach. So often if we're burnt out, we are really drinking lots of coffee to stay awake and to give ourselves energy during the day. But coffee on an empty stomach just contributes to anxiety, which snowballs burnout. And then eating regular meals, I think, is really important for those who are burnt out and overwhelmed. We tend to forget to eat, and hangriness and low blood sugar is never good for burnout either. That tends to snowball things as well. So regular meals, coffee, definitely no coffee on an empty stomach, and prioritize sleep are my 3 biggest tips. Yeah.
Perfect. Let's give it 1 second here for anyone else. Otherwise, we will wrap up. All right. Well, thank you very much, Brenda and Lynn. Honestly, it was a great talk, and lots of stuff people can take away from this, and hopefully enable or enact in their own lives and be able to get involved in some of these different group treatments and different options that are available to them. And it's a great way to look at solutions for an otherwise very not good looking healthcare system at the moment, and people being overworked and tired and just a shortage of staff. So this could be a great way to address that. So we thank you very much for your expertise on this and sharing that with us. And I'll just shout out a few things coming up in the chamber world. Next month we have another boss event, which right now will be Kevin Lynch from Shop Now Mortgages. We have a TBX the first Tuesday there, which will be at the Peterborough Axe Club. And we are also working on our Chamber AM. The speaker will be announced shortly. And yeah, we're very excited for what's coming up with the Chamber. If you want to get involved with anything, have any questions, want to be involved in a boss series in one of our other opportunities, sponsorship, whatever it might be, feel free to reach out. And we have our excellence coming up in a month from 2 days ago. So October 19th, also known as Nigel's birthday. If you're interested to come out to the coolest birthday party, we're honoring all of the local businesses through that. So come on out to that. If you don't have your tickets already, get your tickets, come on out. It's going to be a lot of fun. But again, thank you so much, Lynn and Brenda, and the entire team at PCNM. You are all great.
Thank you, Nigel. Thank you, guys.
Thank you.
Thanks, ladies.